This panel is hosted by the Gairdner Foundation in partnership with RCI Science. The Gairdner Foundation has been at the forefront of honoring outstanding contributions in biomedical research worldwide. Their annual Canada Gairdner Awards celebrate the remarkable achievements of researchers across the globe, acknowledging their significant impact on the advancement of science and medicine. RCI Science now, they're a registered charity whose award-winning programming sparks curiosity and builds community in creative, inspiring, thought-provoking ways. Everything from nature walks to cocktail workshops and everything fun in between for scientists and everybody. So thank you all for joining us as we dive into the global state of mental well-being. We're going to explore how digital media is reshaping our understanding, and I hope, too, to offer some practical steps to safeguard all of our mental health. And this is so important to me personally as an individual with lived experience of severe and persistent depression. I wrote in my memoir about my childhood struggles and how I carried them with me throughout my life, asking, begging in my own personal ways for scientists to make important discoveries that impact people like me on the ground every day. So that's the importance of the conversations that we're having today. The science isn't just out there in some ivory tower. The science has real world impacts in the way that people live and thrive. So today, we're so excited to begin with an important video that brings together voices from global experts in mental health communications. Now, these speakers, they're going to share cutting-edge perspectives on the evolving intersections between mental health technology and accessibility. Then after the video, we're going to move into a live panel discussion where I'll be joined by three absolutely outstanding experts. We have Dr. Rennie Linklater, Dr. Chris Mushquash, and Dr. John Naslund. Together, we're going to explore some of the big questions that are facing mental health in the digital age. These questions, they include how technology can help to bridge gaps and support mental wellness worldwide. So thank you again so much for being here. Now, check this out.
My name is Vikram Patel. I'm a psychiatrist. I currently serve as the Paul Farmer Professor of Global Health and the Chair of the Department of Global Health and Social Medicine at Harvard Medical School.
I'm Elizabeth Patton, and I'm the project lead for the Mindframe program here at EveryMind in Australia.
My name is Rennie Linklater, and I'm a member of Manitou Rapids, also known as Rainy River First Nations, which is in the traditional territory of Treaty Number 3 in northwestern Ontario, and I'm also Senior Director of Shkabe-Makwa at KMH.
Why is mental health a civic issue? That's a really good question. I think mental health concerns is certainly a public health issue. In Australia, we know that so many people are impacted by a mental health concern each year. And we've got data, different stats that come out about how many people are impacted. But if you count not just people who have a diagnosis or experience an episode of a mental health concern, but you also count the people who care for them, their family, friends, colleagues, the impact that it can have on, a workplace when people are calling out unwell or when people die, by suicide, then that's almost, everyone.
Mental health is a civic issue because we all live in the same community, the human community. We are families, neighbors, nations, so we should all aim to live well together.
Why is mental health getting worse? It's no surprise to me that this is a very frequent search by people in the community because, of course, they would be alarmed by the frequent news reports that mental health is getting worse, particularly for young people. While there is some empirical evidence in support of the prevalence of mental health problems rising, unfortunately, we still don't have a firm answer as to why it's rising. And that, for me, is one of the most important questions facing the mental health community today.
I'm not sure it is getting worse. I think it's getting more recognition, for starters. I think we're getting better about talking about it. So suddenly we're seeing it and we're hearing those conversations more often, which in turn I think encourages people to do something about it. So people who may have been experiencing symptoms or experiencing distress may have internalized it and just tried to get on with it, that now they may actually be reaching out for help. So that will change, the numbers in the stats. It will change the stories we're hearing. So yeah, I'm not sure it is getting worse. So I'm not sure we could, for example, blame social media for making people's mental health and well-being worse. I think that things like social media have done a great job of unveiling things that were already there.
Is mental health a social justice issue? An important element of our work at Mushquash is to advance health justice. Health justice is important because Indigenous people were intentionally harmed by Canada's legislation and residential school system, which took away our culture and ceremonial practices. These practices were an important aspect and underlie the Indigenous healthcare system. So in terms of seeking justice, we need to be able to bring these practices back into our lives and have them as pivotal points of care. In a very interesting evolution of our work, Mushquash released its strategic plan last February, Connected CAMH, and health justice was a prominent feature, recognizing that many peoples and populations also seek health justice in terms of their care.
Why is mental health stigmatized? I don't know, but I wish it wasn't. I think in terms of stigma, we still have such a long way to go. In Australia, we've done, I think, a pretty good job of destigmatizing our most common mental illnesses like depression and anxiety. We have a lot more conversations about them, a lot more understanding about what it's like, how it impacts people. But we still have a long, long way to go to destigmatize our more complex mental illnesses like schizophrenia, for example, or psychosis, that there's still a lot of stigma and lack of understanding there. They're less common, but they're often the only times we'll see them in the media, for instance, is like when it's a murder trial, for instance. And if that's the only time you ever see it, that can have a big impact on what we think about someone with schizophrenia or psychosis.
Well, I think for many different reasons, but perhaps the most important is the way we've historically treated people living with mental health problems in the healthcare system. For no other health condition is there such involuntary, coercive, and oftentimes violent experiences that people with mental health problems have had to endure over the last century. It isn't any surprise to me then that when the healthcare system itself violates the basic rights of people with mental health problems, that the problem itself becomes stigmatized. Having worked and researched in many different parts of the world, the first thing you notice is on the surface how different places are. Just as one example, in high-income countries, you will see a lot more urbanization. You will also see a much greater number of mental health care services, often provided by mental health specialists, whereas in most low and middle-income countries, the situation is really quite different. Many of those countries are more rural, but also have very limited mental health services. But if you go beneath that superficial difference, you find that actually people are more similar than different in different parts of the world. So, for example, we know that psychosocial interventions built around a particular mechanistic theory, for example, cognitive behavioral theory, work equally well in people in very diverse contexts. And that suggests that there's something more common in the experience of mental health problems and how people respond to interventions, despite cultural differences. We also find that there are differences, for example, how people might experience their symptoms of mental distress, because of course language is such an important medium to express distress, and languages vary enormously in their vocabulary and in different contexts. We find that people may deploy different forms of illness narratives to explain their mental health problems, and therefore what actions they might do in response to that. But I have found that no matter where you go, particularly for mood and anxiety problems, people in all contexts often view their suffering not through the prism of a biomedical psychiatric diagnostic label, but much more likely through a narrative that really locates their suffering in the context of their social worlds. Here again is an example of a similarity across different places.
Some of the best practices for sharing complex mental health topics with a general audience, one of the big ones would be being really thoughtful about the language that we use. More complex considerations around language is to actually think about people's language preferences. Language can be intensely personal. It's how we label ourselves or how we think about ourselves. And not everyone likes to use diagnostic labels, for example, but some people do. Some people like the term mental illness and others like disorders. Some don't like either. Some cultural groups don't like the term mental and prefer to address the concept of well-being. So that makes talking to a general audience quite complex because they're made up of people with lots of different and sometimes conflicting preferences. We would usually recommend using like person first language that acknowledges that people with complex mental health issues are more than just a diagnosis. So, not calling someone a schizophrenic, for example, actually using that kind of person first language. We would also recommend reducing the really jokey and colloquial language and using accurate terminology, but with explanations for what they mean. And then we would also want to use empowering or strengths focused language where we can as well, and avoid too much focus on deficit. We'd also want to avoid generalizations with our language that make assumptions about people's experiences. So instead of using terms like suffering or affliction or battling, we recommend like more neutral options. And that leaves space for people who may have a mental illness diagnosis but are managing their symptoms, or for people who live well with their mental illness, or who may have experienced an episode but are in recovery, as well as people who have more negative experiences as well.
When I think about Indigenous worldviews and reflecting on, what is a worldview and how is it that one sees the world, I've really come to understand that it's about grounding and it's about orientation and it's about life experience and our education journey in terms of my learning journey and my educational journey. And very fortunately, I came from a family who was very grounded in ceremony and in traditional knowledge. So I got to grow up in a different way, I would say in my 20s and 30s. And I think that becomes really important for those of us that are working in the context where our worldviews are important, where they're drawn on to inform services and research and education. And when I think about the importance of even holistic frameworks and how it is that we experience that. And we have tools that really help with those frameworks, like the medicine wheel, for example, which really captures those balanced elements between, our spirit, our heart, and our mind and our body. And I think that those are really important ways that that we understand and we sit really firmly, I think, in those ways and in those frameworks. The other reality is that a consequence of colonization is that we've learned other people's teachings. And so some of our communities and some of our people are not aligned with Indigenous practices and Indigenous culture. And I think that we need to be mindful of that.
Communities play profoundly important roles, particularly in promoting mental health, preventing mental health problems, early interventions when someone is already experiencing distress, and then also in enabling the inclusion and recovery of people living with serious mental health problems. Just to give you a few examples, we know that social connectedness is a profoundly important factor that helps promote resilience and promotes your ability to handle adversities in your everyday life. This is why the loneliness epidemic, as it's called now, has become so common, is because societies have become increasingly fragmented, in part because of rising levels of inequality. And that has weakened the bonds that we need with one another in our communities in order to promote our mental health and well-being. Let me give you another example, which is the deployment of members of the community to provide psychosocial support and indeed clinical interventions as well, both in the context of early intervention for people who are experiencing distress, as well as in the context of providing the kind of support you need to achieve recovery goals for people who are living with enduring serious mental illnesses. Online communities, just like the general community, play very important roles, both in protecting but also potentially harming our mental health. And so we have to harness the positive, promotive qualities of online communities. As one good example, we know that people who have been marginalized, minoritized, or discriminated in various ways often find online communities with other people that they identify with as safe spaces in which they can establish relationships, have conversations, and support one another. That is a great example of a promotive role of online communities. But equally, we also know that certain online communities can become places where people predate on other people, particularly more vulnerable younger people, where, for example, bullying and harassment becomes a commonplace experience. Those are examples of harmful online communities. We can do a lot to curtail those kinds of communities.
I think it's really important to be a good listener, to be able to sit back and to hear someone's story and what it is that they might be asking for, how it is that they might see what they need in order to be well or what they need on their care pathway. And I also think it's really important not to actually make assumptions about cultural care. And, I often talk about the diversity within our communities when it comes to culture. And we have a lot of diversities, even amongst First Nations, Inuit, and Métis people. And, even diversities amongst our own peoples, whether they're various different First Nations that live across the territories, and even different understandings of language and cultural protocols and practices.
We can learn a lot from one another. For a long time, we thought that cultural differences between different groups of people was so profoundly important in influencing how we could generalize mental health science that had generated from one particular cultural context to others. And that was a recipe for paralysis. Today, I can tell you that there are, of course, very important cultural differences. Those differences apply even within one context. Consider, for example, Canada, where there are enormously diverse cultures that cohabit in Canada. The cultural differences are important to embrace in the way we design mental health programs. But they are clearly not an excuse for us not to do something in cultures from where we don't have sufficient science. Because we do know that there are great similarities between how people in different cultures experience stressors, how they respond to them, how it shapes their mental health, and perhaps most importantly, how we can support their recovery journeys.
The story that really warms my heart is the work that we've been able to do at the Center for Addiction and Mental Health, which of course is known as CAMH. And in 2016, we became the first hospital in Ontario to open up ceremony grounds that had a sweat lodge right on our campus. And I think of the work that we did prior to that, and even coming to that place of, is it all right for a hospital to have a sweat lodge? Is it all right that we're offering this, to our patients in terms of the way that we're going to be providing care? And we did a lot of engagement, I would say, around that. And not only with our communities in bringing forward what was needed for people to get well, but even reflecting on our own experiences.
Social disadvantage, which of course is a broad umbrella term for a range of deprivations that people might experience in their life, and their mental health are intimately connected to one another. In fact, I would argue it's like a vicious cycle. If you experience social disadvantage, you're more likely to develop a mental health problem. And very often, when you are living with a mental health problem, you will suffer social disadvantages as a consequence.
I thought about my experience, which was up in my home community in northwestern Ontario. And I started to think about those people that are in an urban center and that aren't connected to their families. They're not connected to their communities. They don't have, healers and elders readily available to them that they can go sit with. And I thought, we need to help our people who are in hospital be able to connect with our cultural care.
The important question really here is, at what point in our life course do these adversities affect our mental health the most? And what developmental science shows us is that adversities in the early years of life, which we now understand extends all the way up onto your early 20s, are profoundly important in shaping your mental health. This is, of course, because the brain is very plastic, that is to say, very sensitive to environmental influences during those early years of life. If we are to achieve population well-being, this means we need to act on addressing harmful social environments in these early years. Simply focusing on treatment will not achieve that goal.
Safe media reporting particularly applies to how we report about things like suicide, where there's quite strong evidence of an association between poor reporting and further suicidal behaviours in our communities. So that includes increases in suicide deaths and attempts. So in some cases, that research is actually strong enough that it's been deemed causal or a direct link between how the media report on it and further suicidal behaviour. On the flip side of that, there's emerging evidence that good communication about suicide can actually help to reduce suicide rates. So it's not all bad news. And safe reporting is us asking journalists to follow guidelines like we have in Australia, the Mindframe guidelines, to help reduce that risk of further suicidal behaviour and encourage people to get more help. So safe media reporting means removing details, particularly about suicide methods or public locations, and also reducing the prominence and volume of reporting on celebrity suicides. Those two things are actually where the risk of that further suicidal behaviour is the highest. So there's up to about a 30% increase of risk if we include those things in reporting. Taking care with language and images. We don't want to have really safe text in a news story, for example, and then have an image that shows a suicide method. It's also about encouraging us to include details of where people can get support if they're in distress. So it might be the number for a local helpline. It may be a URL for a support service that's web-based. It needs to be clear that stigma is another kind of harm that can result from how we communicate about an issue like mental health concerns or suicide. How we communicate matters because it can influence community attitudes, people's individual attitudes about others or about themselves in either positive or negative ways. Overall, I think storytelling or personal stories can really help to demystify or to humanise mental health concerns. Often our myths or misconceptions come from not knowing or understanding. So when we hear the story of a person's lived or living experience, preferably in their own voice, it's much harder to cling to stereotypes. One thing I'd like people to take away is that we really don't know what other people are going through. We don't know what their experiences are. And because communication is so important, the way that we talk about these issues can have a big impact on people, and we may never know it. And it may be positive or it may be negative. So taking care with how we communicate is incredibly important, because we never know how we may impact other people.
You know, there has been sometimes concern, I think, that is raised around Indigenous practices and ceremonies. And sometimes there's comments about that they're not evidence-based, that they don't really fit within the medical system. And I find that dialogue, you know, quite dismissive, actually. And, you know, one of the reasons why is that I've long held that, you know, as people, as Indigenous people, you know, we've long held evidence-based practice as part of our lives and as part of our, you know, the way that we have continued to sustain and survive ourselves, even on this land. And one of the examples that I often use is that when, you know, when we have a canoe and, you know, if it's discovered that our canoe is leaking, then we would have gotten some sap from a tree to be able to mend that, let it dry. And if it continued to leak, then we would have tried another sap until now we know which sap acts as the glue and adhesion. So, you know, we don't have those leaks anymore. And so I think about that. That's an evidence-based practice, right? You know, it wasn't necessarily in the form where we were writing things up in journal. And I think even in academia, that form of evidence documentation, you know, has evolved in, you know, these recent decades as well. And so I think, if anything, that we really need to open our minds to even the anecdotal experiences that we know as healthcare service providers about what's helping our people heal, because we see them. What has most surprised me, and I would say it's more in the recent years, but is the ability for the healthcare system to change. And I think about what the healthcare system was like 25 years ago and how we would try our best to keep people out of hospital, particularly the mental health system, because we would be afraid about what would happen if they were admitted. We would be afraid around lifelong diagnosis that would take over someone's identity. We would be afraid that they might be resistant to taking medications and be restrained. You know, that there was a lot of kind of concerns that we had. We would be afraid that people were being misunderstood. And perhaps having diagnoses that weren't necessarily appropriate. And we were also very concerned that they might end up in a system that really actually can't help them.
Sometimes we can get extremely pessimistic about the state of mental health science, because we're often told that nothing we're doing actually is making any difference. What I'd like the listeners to take away is that there are profound advances in a range of different scientific disciplines: developmental science, cognitive neuroscience, psychological science. And alongside those scientific disciplines, we have tremendous learnings from grassroots experiences on how we can promote mental health, prevent mental health problems, and help people living with mental health problems recover. What I can say is that business as usual, which is predicated on a very narrow psychiatric or diagnostic model of framing mental health, has not worked. But these other approaches, these other scientific disciplines and grassroots experiences are clearly showing us ways in which we can upend these paradigms and transform mental health globally.
A vision to transform mental health globally. What an inspiring message to end that fantastic video on. And leading from that, we're just thrilled to have a distinguished panel of experts with us today who are going to bring some unique perspectives and contributions to the field of mental health, particularly in advancing culturally relevant and inclusive practices. So now I'd like to note that we're going to have time at the end of the session today for audience questions. So please feel free to jot down any questions you might have on a little notebook or something on your computer or your phone and hang on to them as the discussion unfolds. So first, let me introduce each of our panelists. First, we have Dr. Rennie Linklater, who you heard from just now in our video. She's Senior Director at Shkabe Mukwa at the Center for Addiction and Mental Health, CAMH, as you know it. Dr. Linklater is a member of the Rainy River First Nations in northwestern Ontario, a leading advocate for integrating Indigenous knowledge into mental health care, and she's pioneering approaches that honor cultural and community-based healing. Now, next we welcome Dr. Christopher Mushquash. He's professor in the Department of Psychology at Lakehead University, a psychologist at Dilico Ashinabek Family Care, vice president of research at Thunder Bay Regional Health Sciences Center, and chief scientist at the Thunder Bay Regional Health Research Institute. Dr. Mushquash recently received the 2023 Canada Gairdner Momentum Award. His work focuses on Indigenous-led mental health and substance use research, creating culturally relevant mental health services for Indigenous communities. And now finally, we're joined by Dr. John Naslund. He's co-director of the Mental Health for All Lab at Harvard Medical School and faculty member in the Department of Global Health and Social Medicine. He's got expertise in psychiatric epidemiology, implementation science, and digital mental health. Dr. Naslund is dedicated to improving mental health outcomes worldwide. So please join me in welcoming our distinguished panel, and let's jump in to our discussion. And just a reminder, too, that we're going to have the Q&A at the end. I want to make sure that we remember that, so that way you take down all of your questions, and we're going to try our best to get to them. So let's come into this and level set a little bit, just to all get on the same page. I'd like to start by asking each of you to give your brief, just a few word definition of what we actually mean when we say mental health, because I've learned that not everybody necessarily has the same definition. So Dr. Linklater, can we start with you? How do you personally and professionally define mental health?
Thanks so much, Mark. And that's a great first question, I have to say, because it's interesting because the kind of definition of mental health is the absence of illness. And so, coming really from, First Nations perspective that understands holistic health, I always think about wellness. So to me, to have good mental health would be to be well in the world.
To be well in the world. I love that. Dr. Naslund, would you agree or have anything to add on that definition of what mental health is?
Yeah, no, it's a terrific question. So I think of I really like that definition, and I'm thinking when I think of it, I think some mental health is something we all have and we all need. We need good mental health. We all have mental health. We know it fluctuates just like our physical health. But when I think you get into mental illness is when it starts to affect how you function. And I think, how we see mental health, it varies, of course, across cultures and other parts of the world and within our communities. But we know that when your mental health is not good, that's sort of a universal bad experience for anyone, really, and it affects functioning, and that is universal in how it affects functioning. It may happen in different ways, and we might see mental health differently, but I think the bad parts are we do see that, and that can vary with severity, but we know that that's something we want to try to help address. So I think of mental health that way. But
functioning is such an important part here because, of course, sadness and depression aren't the same thing. For example, they contain a lot of overlap, but such a key difference is in the functioning and how it affects functioning, I think, in terms of severity. Dr. Mushquash, how would you define mental health?
Well, I think similarly. I mean, you can think about it as in a sense, a state of balance, a place where people sort of have purpose in their life. They're hopeful about something. They belong to a group of people that care for them and have some source of meaning in their life as well. And that's a broader definition that comes from a lot of work that's been done for the last 10 or 15 years nationally by a lot of different Indigenous groups. Similarly to Dr. Linklater, the comment about the absence of illness, I think is pretty narrow. And then it sort of forces a conversation about mental health disorder, further to Dr. Naslund's comment. And so I think what's important is that, however we talk about it, we're quite clear with what we mean. So I think starting off at this point is an important one because there's a lot of concept sort of creep when it comes to the conversation around what is mental health.
But that concept of balance or homeostasis, I think, does help to normalize and bring together body and mind in a way that doesn't collapse one into the other. Because I think, and we could talk a bit more about this, and we heard of this on the video too, there is a lot of that happening now where mind is brain. And there's probably lots of people listening today who would agree with that perspective or who might fall into a more dualistic camp. But we can unpack some of the different philosophies here as we go along. But Dr. Mushquash, I want to stick with you for a second, because from your perspective, what do you think are some of the most significant trends that we're seeing in mental health globally? I think that does give us a sense of what the conversation is around mental health and these different philosophies, different definitions that are out there. So what are the trends that are emerging in global mental health, and how do they intersect with the ways in which mental health information is shared digitally and especially socially?
It's a great question. I mean, global trends, everything from, you see different experiences of anxiety and depressive mood, depending on the age group, depending on place. You see a lot of uncertainty, difficulty with thinking through what the future may hold for us as communities and individuals. I mean, that's in the context of economic uncertainty, violence, climate change, and so on. But also sort of a massive access to information in a way that we haven't had before. That can also be either a source of so let's say knowledge, but also potentially a disrupting force when it comes to the ability to access good information, or to to be able to kind of step away from the negative information that we have such such available access to take a break from those moments when I think people are really overwhelmed. I think another trend I'm sort of noticing more in Canada among some young people is a bit of a tendency toward identifying a little bit more with the pathology of the pathological side of mental health, right? So the disordered side versus conversations around capacity, resilience, capability, and so on. And so I think those are general trends that I've noticed. There's data on this that we can speak to as well, but I think that that there's a bit of a pressure through a lot of social media, of course, through these important developmental periods where young people are looking to identify with something, and sometimes we identify with the difficulties that we have rather than the capacities and the communities that we have.
Mm-hmm. And the pendulum really does seem to swing historically, I think. And maybe in a social media kind of world, we forget everything that happened outside of that 7 seconds that you saw that social post, or even the last few days, because it changes so quickly on social media. But I've noticed what you have as well, that there does tend to be more of a tendency toward diagnostic, structured kind of language. And I've noticed a number of studies that have come out recently which have suggested that there could be a contagion effect of conversing about mental health on social media, particularly among adolescents in this respect, with self-diagnoses and sort of the lack of quality information on social media. So I want to turn to Dr. Naslund then on that piece. What are your thoughts, Dr. Naslund, on the impact that social media has on public mental health perceptions, how we think collectively about mental health, that pendulum swing, as well as the potential for the potential injection of misinformation in that swing?
Yeah, so that's I think so. I view social media in kind of I see it from kind of looking at it from both sides. I've met people actually through social media who live with severe mental illness and have described actually their experiences of connecting with other individuals online. I'm thinking of things like schizophrenia or other more severe mental illnesses, and feeling horribly alone and isolated and cut off. Like they described how basically all their social connections, their family essentially isolated them after their onset of their illness or their psychotic break. And they actually found almost hope and meaning through people they met with on social media. And I think that's just an incredibly compelling example. I mean, I've met people about my age, which I think is probably why it resonated, and who had been sort of experiencing homelessness and had just been in the absolute most dire straits, and actually connected with other people on social media, the most unexpected avenue, because they didn't have those connections within their social circles due to stigma and other concerns. And then they talked about also negative experiences with the health system, and then they were able to kind of learn from others on social media who had the same experience, and they found that incredibly validating. So they realized, I'm not alone with what I'm experiencing. I'd say another tremendous trend that I've observed is we're talking about mental health a lot more now. I know I've been doing research in this field for some time, since my PhD. And I used to go and say, yeah, I'm doing work in severe mental illness. I do work in community mental health centers. And people would say, well, why would you do that? Why are you doing work like that? And, and fast forward, 8 years, now when I say I'm doing work in mental health, people say that's incredibly important. And then they tell me usually about their own story. And they say, well, or they talk about either themselves, or they talk about someone in their family who's been affected, and maybe how they've had a positive experience. And I see that really having come about actually because we're talking about it a lot more. And I think social media has helped advance those conversations. It's really, I think, helped serve as a valuable tool to combat stigma, to share, valuable experiences, as I mentioned. I think on the flip side, we're also seeing a lot of the negatives, and these get the press, these get the news, these make it all the time, how social media is having just horrible effects on young people. And I don't want to discount those. I think those are real. I think it's created a new avenue for bullying, essentially taking bullying, which has happened, put it onto an online environment, and then, accelerated it or hyped it up, in ways that I think are happening faster than, say, we're able to kind of stop it or understand it. So I don't want to discount the impacts that social media, the detrimental impacts it also has. It's trying to find that kind of healthy medium where in between. And I think we're at the point now. Social media is not going anywhere. We have to, it's here. I think that's pretty well established. But how can we use it in a way and understand, that it does have these negative impacts, but how can we try to mitigate those while trying to find the positives, which I do think are there in some ways. So.
Yeah, really about it. What you're listening to really reminds me of this idea of how can we nurture and cultivate the positives, and there certainly are. The consumer survivor movement has taken many forms over the generations. And I think what I took from that early on in my diagnostic history was that when you're feeling alone and alienated and separate from everybody, you have a tribe. Some of the most interesting, fascinating, funny people I've ever met in my life were on inpatient psychiatric wards. You make friends for life in those kinds of environments because you already, by default of your shared experience, know more about each other than we often share in common company. So there is a bond there, I think. But then there's that risk too of falling into this environment where you can be influenced by misinformation. So you mentioned there, though, Dr. Naslund, that we can do something about this. What strategies do you think are most effective for accurately communicating mental health science to the public and perhaps counteracting some of the misinformation that might occur within the social media realm?
Yeah, it's a great question. And I think something, we're all kind of grappling with how to do that. I think some of the onus falls on how the platforms themselves function, how the algorithms work. I mean, pushing just how sensational content gets pushed and viewed can lead to, derogatory messages picking up a lot of traction and being shared more rapidly. I think there has to be some way to identify those and flag those types of posts. I know some of the platforms are improving. They're improving their experience on how they flag these types of, harmful, derogatory, types of posts or things that maybe are promoting self-harm or suicide. Those are the types of things that there are efforts to flag those, but I think there's a lot more that can still be done. And I also think it's actually trying to work with individuals around their own behaviors. I mean, I know a lot of young people I talk to, they're very self-aware that how social media makes them feel terrible, and they know that I'm on here, and I've been scrolling for the last 3 hours, and I've realized how much time has gone by. It's starting to kind of recognize that self-awareness and trying to think, how can we put limits on our own behavior. I know that that is sort of putting the onus on individuals, but I think it could go a long way. But I think between the actual platforms sort of flagging harmful content, and then allowing individuals to flag that content as well, especially things that are misinformation, and stepping in to sort of correct those types of things would be really helpful.
I've learned so much from the trauma-informed care community, in which, there's the old saying that what you happen to you isn't your fault, but your recovery is your responsibility. That even though the environment out there might be a bit of a toxic wasteland sometimes, or it might appear that way, we can still proactively do things. We have our own agency to protect ourselves and others. And I'm fascinated by the body of research that emerged. I think it was over the pandemic, perhaps, or maybe even earlier, around how calling people out, and this is with respect to vaccines and autism, calling people out doesn't necessarily work. They can sometimes dig in, it can reinforce their negative beliefs, it can drive them into camps further. So I respond well to this idea of calling people in, inviting them into a conversation about more accurate representations, I think, of mental health. That's what I would hope for in the future anyway. Dr. Linklater, looking ahead, how do you envision the future of mental health communication, particularly, in combating some of that misinformation and stigma that is still, in some ways, just as pervasive as it always has been?
Yeah, I think, this is so important in terms of, I think, not only the safeguards that we need to start thinking through around people's safety and being in the world. And, I can't help but think that there's a real role here, for us as individuals, as parents and families, communities, systems, even the education system, around really engaging young people in these dialogues, given the availability of information, the opportunities to participate in different social media groups. And, I really think that we have a tool actually at our disposal here, and we need to be really mindful in which ways that we choose to bring it into our lives. But, there's a great opportunity when we think about increasing access to information and participating in kind of this more of a global society. And I'm reminded of the amazing work that some of our young people did when they convened a group called We Matter. And so this is searchable. And, there are hundreds of videos of Indigenous youth that are talking, about their lived experience and what it is that inspires them to still matter in the world and to still be alive in the world. And I think that, we have lots of different ways to connect that we didn't necessarily before. And so part of this, I think, it even can be around virtual care services when we're thinking about, this new digital age and what is it that we're provided with. We think about lots of the different learning opportunities, actually. I think about how our team at Shkabi is able to really shift the way that we're providing professional development to, the workforce, across the province. And gone are the days that we were all in person all the time. And I think that we have opportunities really around efficiency and efficacy as well. And so I think for me, looking forward, it's really thinking through how can we convene in these spaces that are often more accessible, but shift some of the ways that we have been familiar with connecting as well.
Dr. Mushquash, I want to turn to you again one more time for a second here. I think such an important part of what I hear you all saying is that this can be a good social media in general, and it's not just one thing, can be a good tool if we know how to use it. And that's not just young people, that's people of all ages, I think. How can we critically consume information, especially when the algorithms are so often rigged against us? They're programmed to get us excited and engage us in that way. What's your advice for how we can learn to take the best of it and leave the rest of it when it comes to social media?
Yeah, thanks for the question. I mean, I think the evidence would suggest more mindful use, and so rather than letting time slip away on social media, being kind of purposeful with respect to what you're accessing and for how long. I tend to think about it sort of from a bit of a developmental hygiene kind of perspective, right? So if you think that there's 24 hours in a day, and about 10 of those hours, suppose if you're an adolescent, is meant to be sleeping, and you've got about 14 hours, and maybe there's about 2 hours of that where you're supposed to be eating. And you keep doing the math, about 6 hours in school, and you keep going down. And at the end of the day, you've got 4 or 6 hours to develop all the things and all the skills and all the competencies and all the social relationships and so on that you need to kind of have a meaningful life and do those things that you want. Now, if you take of those 6 hours and you spend 4 of them on Instagram or 4 of them on, any other social media platform, that's 2 hours. And that's a simple kind of math problem, right? And so if we're mindful about how we engage with these types of sort of entertainment outlets, let's say, then we can be purposeful as well with respect to all the different competencies, but also encouraging, decisions and policy that allow communities to gather and families to spend time together. I mean, things cost money. We what you'll find oftentimes is people are willing to engage and do things that are really interesting and fun, but oftentimes it's a matter of availability of those types of opportunities as well. And so if we can kind of get the balance right, I think there's a lot of good to be had. A lot of connection as has been discussed, and the opportunity to really think through how we're going to engage and for how long we're going to spend on these kinds of modalities.
Mm. We're running out of time here. Unfortunately, time flies when we get deep into these kinds of issues, especially with folks like yourself. So I want to go around once more, just with a brief answer from each of you of how social media is, or how it might be, a positive force for mental health communication. Maybe there's something you would do to change social media, or maybe something you would tell your kids or grandkids or young people in your lives so they can use it as a positive force for mental health communication. Dr. Mushquash, since we're already with you, how can we use social media as it is today for positive mental health communication in the future?
Yeah, I think it's purposefully engaged with connection with peers, like-minded people who have shared value structures, and really paying attention and making sure that we're developing healthy, adaptive communities and prioritizing things that keep us well.
Mindful use, I love it. Dr. Naslund, how can we use social media for a positive force for mental health communication?
Yeah, no, I really like this concept of mindful or purposeful use, and I think yeah, I agree completely. It can serve a valuable tool to connect with other individuals, especially for people who may feel isolated or cut off in their own social circles, or may not feel comfortable sharing things with those around them. I also think social media might not be something that, to say it has benefits for everyone, I also don't think, I'm not sure that's accurate either. Maybe it's coming back to some self-awareness that might not be the place to connect with other people, and it's all right. I think it's also important to have sort of that realization that, yeah, actually it's not a good place for me to connect with people or to be with others, because I end up wasting a lot of time, or I end up really engaging in things that aren't good for my health. So I think having some ability to become self-aware of how we use social media, I think, is useful, and encouraging that kind of realization if it's not helpful. I think on a more kind of broad spectrum, I do think it is still a valuable platform to share information, but that can also happen outside of sort of the more popular social media platforms. There's also other avenues online, whether it's online forums, which I think are kind of like social media but not quite the same, which can also serve as valuable platforms to share information and to help advocate for mental health, addressing stigma and things like that.
For sure. Dr. Linklater, last word to you. How can we use social media as a tool? You were speaking of it as a tool for good.
Yeah, I think one of the things that I'm really just so aware of is the space that we put ourselves in. And so I think that, we have agency to keep ourselves in places, even within social media, that might be a, more positive frame. And like, this is a real, piece to ourself and kind of our own, management, and also in having conversations with young people, which might, they might find themselves in places that are unanticipated and, to some extent harmful. So I think that this goes back to ensuring that we, we're engaged with our families and with our kids, and particularly our young, our young people, around their experiences within these platforms as well, and really encouraging people to have some boundaries, around what they're willing to participate in as well.
That's a great answer. Now, I want to take us right to the finish line here. So I'm going to try to fit in one last question from the audience, and I'll lob it over to whoever it can answer it, because I think it's a good one. How can misinformation affect somebody's willingness to seek help or follow recommended treatment courses? And how can healthcare providers better help these people? So misinformation, especially out there on social media, how can it impact help-seeking behavior and how people follow their recommended treatment? Who would like to jump in on that one?
Yeah, I'm happy to jump in. First, but I would say it really depends how we define misinformation. Because when I've spent time on social media around mental health in particular, if someone's questioning the care they received or talking about a negative experience or side effects from a drug and saying that this has been horrible for me or something, they may not be, advocating something. They're talking from a personal experience, and they may be saying that they don't feel that treatment helped them. And oftentimes that actually can be a valuable discussion. So I would be careful how it's misinformation. If it's very blatant, like it's just totally sharing something that's, fake news or something along those lines. But when I think it comes to actually how people experience their mental health and their treatment journey, I think it would be difficult to label that as misinformation. It could actually be really valuable insights that someone needs to read and learn about, and may have actually had a similar experience, but not shared it online. So I would just that's my only sort of caution there. And I don't know if that could actually be a really valuable tool if it's sort of contradictory to what actually their clinicians may have said. Not that I'm saying you don't listen to your clinician, but I think sometimes you can learn a lot from people's comments online. That's been something I've observed.
In fact, I think that's how our fields have moved forward. So it's so important to have those critical conversations, particularly if you're taking a scientific mindset where we do want to interrogate all of the available evidence and not just appeal to any one viewpoint. So that is all the time, though, that we have for today. Thank all of you for joining us. And thank you to the Gairdner Foundation as well as RCI Science for hosting this event. We also thank the Government of Canada for their support in this program. And in their support for the mission of the Gairdner Foundation. Keep up to date with all the listings, or all things Gairdner, rather, at gairdner.org, and find them on social media at Gairdner Awards on all platforms. You can also find out what's going on at RCI Science. Subscribe to their newsletter at rciscience.ca/subscribe, or follow them on social media at RCI Science, also on all platforms. So until next time, thank you to our incredible panelists. I've been your host, Mark Henick. Take care and be well.